Assalamu alaikum guys, I am Dr. Faraz Ahmad and today in this video we will discuss about OET Listening Part A. You people will be thinking that today's back I uploaded a video on listening part, but keep in mind that video was as a whole on OET Listening Part A, B and C. So in this video we will discuss OET Listening Part A in details. Okay guys, so as you already know that OET listening test basically consists of three parts, that is OET listening part A, part B and part C, and there are overall 42 questions and you have to score 30 to get B grade in your OET listening exam. Time is almost 40 minutes, but don't worry at all in OET listening part for time. Okay, so the three different parts of the listening test, and we will discuss only OET listening part A in this video. So guys, as you all know that OET listening part A consists of two different extracts, and from each extract you will be given 12 questions to solve. So from two extracts there will be 24 questions as a whole. This is a very large proportion of questions. So guys, 24 questions from OET listening part A, and these questions will be most easiest type of the question. So this part is the most easiest part of exam. So depending upon the proportion of question from OET listening part A, which is very large proportion, 24 out of 42, and depending upon the difficulty level of the question, which are most easiest part, most easiest question of the OET listening exam. So most of the time your listening result depend upon result of OET listening part A, because questions are most easiest and there are very big proportion of these questions, that is 24 out of 42. If you score 22, 23 or 24 out of 24, then definitely you will be at a safer side, that is you can easily pass your listening exam. So guys, let me tell you that how to attempt this part of the listening test and what are the strategies you should keep in mind while solving OET listening part A. Guys, first of all, keep in mind that question in OET listening part A are fill in the blank type of question. Fill in the blank type of question, that is something would be missing from the sentence with a blank space in between, and you have to fill that space with a word or short phrase you will listen from the audio. Okay guys, officially you will be given 30 seconds to read the extract, but let me tell you a trick here, that how can you increase this 30 seconds up to 1.5 to 2 minutes to read the extract. This will definitely help you while solving OET listening part A. So guys, when OET listening test is given to you, start reading the extract 1 as paper is handed over to you. In this way you can easily read it for 1.5 to 2 minutes. So instead of 30 seconds you can read the extract for 1.5 to 2 minutes. So in this way you will easily read the whole extract and you can easily predict the answers. So while reading, try to predict the answers by focusing on the headings, subheadings. In this way, with a lot of time, that is 1.5 minutes to 2 minutes, and by focusing on the headings and subheadings, you can easily predict the answer in OET listening part A extract 1. Okay guys, let me show you that how you will apply this trick or this strategy, that you can increase your 30 seconds up to 2 minutes. Okay, as paper is handed over to you, audio will start from here, that is occupational English test, listening test. This test has 3 parts. In each part audio will start from here and till here, but there is no need for you to listen the audio of this part. When paper is handed over to you, you should straightforwardly move to this part of a test, that is extract 1, question 1 to 12. As paper is handed over to you, you should start reading from here. You hear an obstetrician taking to a patient called Melissa Gordon for question 1 to 12. Complete the notes with a word or short phrase. Now you have 30 seconds to read at the notes. So your time will start after this. Your 30 seconds will start after this, but you are starting this extract when audio will start from here. So in this way you can increase your 30 seconds up to 1.5 minutes to 2 minutes, and you can easily underline, or you can easily predict the answer from headings, subheadings in this way. Keep in mind that is this 1 2 3 4 5 6 7 8, these are your questions number. So here patient Melissa Gordon works as 1. It's mean this is a question number 1, and he is going to ask you about work or the profession of patient. Medical history has occasional, this is true, this means that this is question number 2, and he is going to ask some occasional attacks, some occasional problems of patient, that is there will be some medical condition. Okay, this 3 is question number 3, and is allergic to medical history of patient that Melissa Gordon is allergic to dash. You can easily hear from the audio, from the voice of the patient, that patient works as patient has occasional attacks of dash, and patient is allergic to dash. And in this way you can easily hear from the audio, and you can predict the answer, so you can write your answer here correctly. Okay guys, let me show you that how much time audio will take when it will start from here, occupational English test. So you can listen the audio, and you can predict that how much time it will take coming to the extract. When paper will be given to you, audio will start from here, but you have to start from the extract 1. And when it says that you have 30 seconds to look at the notes, then your time will start, and you can see that you can add the previous time in these 30 seconds. It will be 1 minute and 30 seconds, or up to 2 minutes. So you can easily read this extract. Okay, let me show you.
Occupational English Test. Practice Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear an obstetrician talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So guys, from this audio you can see clearly that audio will take almost 1.5 minutes from here till here. So now including these 30 seconds in this 1 minute and 30 seconds, you will have almost 2 minutes whole to read this extract. So in these 2 minutes you can easily read this multiple times, and you can easily predict the answer. So giving you so much time and applying this trick, you should score 12 out of 12 in OET Listening Part A Extract 1. It will help you in your result. Okay guys, let's move forward. So when audio starts, listen it carefully for the missing word or the short phrases, and fill the gap. It will be your answer. So you have to listen very carefully for the missing word or the short phrases. When you listen for that word which is fitting in the blank space, it will be your answer. So while listening, in each extract a healthcare professional will be talking to a patient, and most of the time answer would come from the patient. So this is very important point, that most of the time answer would come from patient. So you have to focus on patient voice for your answer. As in, let me show you that in case note, patient name which will be told by patient, medical history will be told by patient, baby's father and the point raised, all the history will be given by the patient. So you have to focus on the patient voice for your answers. So focus on the patient audio or the patient voice, and focus on the word or synonymous word of the phrases or short word which will be fit in the blank space for answer. Okay guys, let me tell you some important strategy here as well, that if you get lost between the question and the audio, use the subheadings or the keywords to get yourself back on the track. Let me show you this. Okay, if audio is starting from the patient name and you get lost here at question number 6, then you should focus on the words before or after the blank space, or you should focus on the heading or the subheadings to take yourself back on the track. This strategy will help you when you get lost between headings or between question and audio. So apply the same strategy for the next question, that is question number 13 to 24. So this strategy will also help you in extract 2 as well. Guys, this is very important that you should score minimum 20 marks out of these 24 to get yourself at a safer side, and in this way you can easily pass your OET listening exam. But I think you should score at least 22, but minimum you can score 20. If you are scoring 20 marks, so you have to score 12 marks from both part B and part C. So guys, keep in mind, in OET listening part A, reading, listening and then writing strategy will work. First of all, you will read the notes, then you will listen for the audio, and then you will write the answer which you listen from audio. So reading, listening and writing at the same time will be working on OET listening part A, and you should be very vigilant while doing this. Okay guys, let me play an audio in background of these notes so that you can apply the strategies, you can apply the important points which I have told you in previous video, and you can solve this OET listening part A. So let me play for you.
Occupational English Test. Practice Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear an obstetrician talking to a patient called Melissa Gordon. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So this first meeting, Mrs. Gordon, is mainly a chance for you and I to get to know each other. I'll ask about your medical history, and this is also an opportunity for you to ask me any questions that you've got at this point.
Sure.
So some background. What kind of work do you do?
I have a job at an engineering company. I'm a computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity leave.
Ah, excellent. So tell me about your medical health. Do you have any conditions I should know about?
Well, I have asthma attacks, but they don't happen often. I lost about 10 kilos, and that certainly helped. I have an inhaler, but I hardly ever use it. Oh, I should also let you know that I come out in terrible hives if I take penicillin, but not other things. I'm fine if I eat nuts, for example. I have a fairly healthy lifestyle. I'm a vegetarian and I've never smoked.
Good.
I'm afraid I don't go to the gym or anything, but I walk to work and generally keep active.
Oh, that's good. So this is your first pregnancy?
No, I have a daughter called Ella. She's 3 now.
Ah, and did everything go smoothly that time?
There were no major problems during the pregnancy itself, but it took me quite a time to fall pregnant the first time. After having various tests, I was given some fertility drugs. Oh, what were they called? It's on the tip of my tongue. Never mind, it'll come back to me. This time, though, I didn't need any help.
Oh, it's no problem. What about labour last time round?
Oh, that was a nightmare. Though everything, thank goodness, worked out in the end. It was a breech birth. It looked as if I might have to have a caesarean, and I really didn't want that. I was pleased I managed without an epidural, too. They had to use forceps to get Ella out, but I didn't need any stitches, so that was okay. Unfortunately, though, I had some difficulties after the birth, too. I was desperate to start breastfeeding, but that didn't work out. At least not until I was given some guidance by the midwife.
OK. So can I ask you about the baby's father?
Sure. That's my husband, Paul. There's something in his family history that I should tell you about, I think. His grandfather and father both had epilepsy, though he hasn't developed it himself. I'm not sure if that means his children have a greater chance of having it or not. Oh, also, he has a child from his first marriage, and she has Down syndrome, so he gets a bit anxious when I'm pregnant.
Oh, well, that's understandable, of course. We can discuss various testing options if you like. You might want to consider amniocentesis, for example.
But that carries a risk of miscarriage, doesn't it? I don't want to go for that. I've heard about another test called CVS. Is that something to consider?
Well, it's certainly an option. However, that procedure, in fact, also carries a small increase in the risk of miscarriage. And you'd need to come to a decision fairly soon, because it's normally carried out between weeks 10 and 12 of the pregnancy.
Well, I can tell you straight away that if there's more risk, then I wouldn't consider it. I know my husband will feel the same.
Well, that's fair enough. So, is there anything else you'd like to ask me about today?
Nothing urgent. But it'd be good to know more about how to get siblings ready for a new addition to the family. I want to make sure Ella doesn't feel threatened or replaced or anything.
Well, there's a leaflet that many parents find helpful. Here we are. Have a look through that.
Oh, thanks, that's great. I'm sure I'll have lots more questions at our next meeting.
Extract 2. Questions 13 to 24. You hear a GP talking to a new patient called Mike Royce. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello? Coming in. You must be Mr. Royce. I understand that you've just signed up with the practice.
Yeah, that's right, Mike Royce. I've joined this practice because my previous GP retired and he suggested I come here.
Right, and I understand you've got an ongoing medical condition you're worried about? Perhaps you'd like to start by telling me about that. How did it start?
Well, I suppose it started out as a really strong pain in my left knee. I think it's called the medial meniscus. Is that right? It came on whenever I tried to bend the knee more than normal. Then I tripped while climbing some stairs at work, and that seemed to make things worse. I started to get these very tender bumps all over the back of the knee.
Right.
They were very painful, even just lightly touching them. The doctor called them trigger points.
Yeah, that's right. They're called that because pain frequently radiates out from them when touched. And how did that affect you day to day?
Well, I went back to work after a week or so, but I was still having knee problems. I couldn't really squat properly or climb ladders. That's important in my job. I'm a painter, and I'm always having to get into awkward positions. Anyway, I kept going back to my old GP explaining that I still had severe pain whenever I tried to bend my knee. He gave me all these exercises to do, and I tried doing them. I really did. I made sure I did gentle stretches before I did anything more energetic, everything really. I tried resting like he told me. I used ice packs when it got sore, but nothing really worked.
Right, I see.
But then the doctor decided I might be suffering from tendinitis, so he sent me for some rehab work in the hospital. That actually did seem to work, at least at first.
But I'm guessing not for long.
Right, the problem came back. I kept telling the doctor that my knee still wasn't healed, but it was actually my physiotherapist in the hospital rather than my old GP who noticed that something was wrong with my muscles. He wouldn't say what it was, but I knew something was up. He was doing myofascial release on my hamstrings, and I was in agony.
Right, so did you go back to your GP?
I did, but he didn't know what I should do about it. So I left feeling completely fed up. That's one of the reasons I decided to come here.
Okay.
I just feel like nobody's taking this seriously. I think it's affected my life in lots of other ways too. The worry's given me insomnia, for one thing. I don't think I have actual depression, but I certainly suffer from constant anxiety about when it's going to flare up.
Is there anything that you're particularly worried you might have?
Well, I've researched this pain I'm getting. To be honest, I'm convinced I've got fibromyalgia, not just some simple muscle problem, because I fit most of the symptoms, and I've had pain absolutely everywhere. Look, I've even kept a pain diary so that I could track what I did that set it off. The weather, if I was working or not, where it was affecting me, what it felt like.
Oh, good.
I figured out from this that it's usually in the same places that I mentioned earlier, plus some newish places too. My shoulders and elbows. And I know that my knee's actually one of the more tender points for it. What do you think?
Look, I must say from what you've told me so far that I'm concerned enough to look into that possibility. So as a next step, we need to get you seen by a rheumatologist. This is a notoriously difficult condition to diagnose, as I'm sure you're aware, because so many of the symptoms overlap with other conditions too.
I won't be happy to be proved right, but I'll certainly be glad to get some answers at long last.
That is the end of Part A.
So guys, this is end of OET Listening Part A. Let me show you answer of Listening Part A Extract 1, question 1 to 12 first. You can easily compare these answers with your answers. Okay, let me show you answers of extract 2, that is question 13 to 24. So guys, thank you for watching this video on OET Listening Part A, and this was all from today's video. So at end, please subscribe to the channel and like the video as well. In addition, please share this video and recommend these videos for OET preparation to your friends. Thank you very much. Bye bye. Allah Hafiz.